Poso, hello. Thank you for joining us today to learn about our scoping study on Indigenous child welfare. Our scoping study addressed 5 research questions. This module is part 1 of 2. Part 1 will describe the problem of disparities in Indigenous child welfare literature throughout Turtle Island, or the United States and Canada. Part 2 will explore the solutions. First, let me introduce you to our research team. I'm honored to be a part of this talented team who brings diverse perspectives and expertise. Wendy Haight is a professor and Gamble Skogmo Chair in Child Welfare and Youth Policy at the University of Minnesota. Educated as a developmental cultural psychologist, she focuses on child welfare beliefs and practices in diverse U.S. and international cultural contexts. David Gleesner is a PhD student at the University of Minnesota School of Social Work. In addition, he is a retired child welfare professional with 39 years of service in child protection, including 6 years as supervisor of child welfare services to ICWA-involved families. We were also privileged to work with our librarian, Scott Marsalis, who serves the School of Social Work on the Twin Cities campus. Scott is an MLIS information professional with expertise in searching bibliographic databases, among other things. Finally, my name is Carrie Wabanascom. I'm originally from the Menominee Reservation located in northeastern Wisconsin, and I'm an enrolled member of the Oneida Nation of Wisconsin, and I've lived in Oneida throughout my adulthood. I began my PhD at the University of Minnesota Twin Cities campus 2 years ago. I have 10 years of post-MSW practice experience with tribal communities throughout Turtle Island. This scoping study addresses one of the most pressing, sensitive, and controversial issues facing child welfare policymakers and practitioners today: the dramatic overrepresentation of Indigenous families in North American public child welfare systems. For consistency, we will refer to Indigenous communities and peoples of North America, including U.S. and Canada, as Indigenous, unless their specific tribal, Indigenous, First Nation, or Aboriginal names are specified in the research, or when referring to a specific law, such as the Indian Child Welfare Act. In Canada, for instance, Indigenous children comprise 52% of foster children under 14 years of age, despite representing just 8% of that age group in the Canadian population. In the U.S., Indigenous children under approximately age 17 have the highest rate of substantiated maltreatment reports and are in foster care at a rate 3.3 times the rate for white children. These and other disparities persist in the U.S. and Canada despite legislation designed to improve outcomes for Indigenous families. In the U.S., the Federal Indian Child Welfare Act of 1978 was passed at the request of the tribes to reduce the involvement of Indigenous children in the child welfare system, halt the removal of Indigenous children from Indigenous communities, and reclaim their cultures. It focuses on Indigenous family preservation as integral to tribal sovereignty and reparative justice. It recognizes that the removal of Indigenous children from their families is devastating, not only for those families, but for Indigenous communities as a whole. Maintaining Indigenous children in Indigenous homes or foster homes ensures continuation of Indigenous communities for future generations. In summary, ICWA places exclusive jurisdiction of child welfare laws and regulations on tribal lands with tribes. Off reservation, ICWA requires tribal notification by county or state child protection agencies of child maltreatment allegations and child custody proceedings involving Indigenous children eligible for tribal enrollment. The law requires active efforts before placing children in foster care, which is a higher standard than reasonable efforts used before removing non-Indigenous children from their families. To remove Indigenous children from their families, the law requires testimony from a qualified expert witness familiar with the child's culture. If out-of-home placement care is necessary, the law also specifies preferences for placements, first with relatives, then members of the child's tribe, and lastly another Indigenous family. Only after these placements have been considered can a child be placed with a non-Indigenous family. Unlike Indigenous child welfare in the U.S., Canadian child welfare has several systems. Child welfare mandates differ across the 13 provincial territorial areas. Each provincial system is shaped by federal, provincial, and First Nations legislation. There is no universal definition of child maltreatment across the provinces. There is, however, a shared goal of protecting children from abuse and basic understandings of sexual abuse, physical abuse, neglect, emotional maltreatment, and exposure to interpersonal violence or substance abuse. The history of North America did not begin with the colonial era. It began thousands of years prior when Indigenous people lived and thrived on Turtle Island. The history of Indigenous genocide and historical trauma in North America is manifested today in many forms of oppression, violence, and structural racism, including within child welfare systems. To heal from the destruction of colonization and genocide, and to ensure the survival and reclamation of their ways of life, many contemporary Indigenous nations embrace the 7 generations philosophy. This philosophy was passed down from our ancestors, and it considers how each decision made today will affect the next 7 generations and beyond. Consistent with the 7 generations philosophy, the high rates of Indigenous families involved in child welfare may be viewed as a long emergency. Climate change scientists concerned with the effects of global warming use the concept of the long emergency to refer to sustained stress to social and ecological systems caused by multiple disasters affecting generations. For example, the aftermath of Hurricane Maria in Puerto Rico, occurring in the midst of a long-term financial crisis, resulted in unmet needs in the face of depleted resources. Indigenous people in the United States and Canada also have endured a long emergency from systemic, premeditated actions to destroy their families, cultures, lands, and spiritual belief systems, beginning more than 500 years ago with the colonization of North America by Europeans. Beginning in the 1800s and continuing well into the 20th century, Indigenous families and children were victims of the U.S. and Canadian government's efforts to forcefully and brutally assimilate Indigenous people. Implementation of official policies severed children from their culture and kinship networks through forced removal from their families. It also displaced them from their tribal homelands and forced them into mandatory boarding school attendance. During the U.S. boarding school era of the late 19th through mid-20th centuries, the U.S. government established Indian boarding schools to force Indigenous children and youth to assimilate into European culture. The goal was to sever Indigenous children from their families and communities via off-reservation boarding schools so that they could more easily coerce them to adopt the ways of the European culture. During this time, children were not only deprived of the care, nurturance, and protection of traditional child-rearing practices, many experienced abduction and then emotional, physical, and sexual abuse in these militaristic schools. While some children survived this treacherous process, many died from disease, malnutrition, and harsh conditions. The forced separation of children from their families and communities during the U.S. boarding school era continues to affect Indigenous families and communities today. Indigenous children in Canada also were forcibly taken from their families. In 1920, the Canadian government mandated that all Indigenous children of school age attend a residential school. During the height of the residential school system era in the 1930s and 40s, between 90,000 and 100,000 children were institutionalized. Although most of these schools closed in the 1950s and 60s, the forcible separation of Indigenous children from their families and communities continued during the 60s scoop. Through the late 1950s and into the 80s, thousands of Indigenous children were scooped by the Canadian government from their families and communities and adopted into predominantly white, middle-class families in Canada and the U.S. Many adoptees lost a sense of cultural identity. Their forced removal from their birth families and communities continues to undermine adult adoptees in Indigenous communities today. The history of government oppression and genocide has undermined Indigenous cultures and created risks for child maltreatment. Historical trauma is the intergenerational trauma from unresolved grief and disruptions to normative Indigenous child socialization processes. It continues to resonate in many communities. Inadequate exposure to Indigenous parenting role models, personal trauma histories, poverty, and racism have damaged generations of Indigenous families. This history also seriously diminished both the capacity of many Indigenous parents to trust potentially helpful services from child welfare agencies and staff members, and the capacity of non-Indigenous child welfare agencies and staff to understand, evaluate, and engage in effective services with Indigenous families. On the flip side, we must also understand that Native Americans survived a genocide, and that there are many strengths and many nations reclaiming their cultures or revitalizing their languages and cultures. Bussey and Lucero summarized 3 challenges Indigenous families involved with child welfare face: a fear of losing their children as others have before them, the caseworker's lack of cultural knowledge, and being judged as an inadequate parent based on non-Indigenous cultural values. Furthermore, they point out that European American-based approaches to child welfare stress individualism, independence, confidentiality, and authority through formal education. These values not only conflict with traditional Indigenous values, they are quite similar to those that provided the foundation and justification for assimilative U.S. Indian policy in the late 19th century, including Indian boarding schools and the Dawes Allotment Act of 1887 that devastated Indigenous communities. From an Indigenous perspective, families are strengthened through kinship bonds, community and tribal connections, values and traditions, language, spirituality, and cultural practices. Through our study, we examined the current state of the published, peer-reviewed empirical literature directly relevant to addressing the questions to understand why disparities persist. Our first research question: what is the current state of the literature pertaining to child welfare with Indigenous families? We wanted to know the number of studies, number of empirical studies, what publication they were published in, the study focus, what groups were involved in the study, what were their data sources, and their research methods and perspectives. We wanted to know if they were looking at the insider perspectives versus outsider perspectives. We also wanted to know, why do disparities in the involvement of Indigenous families in county, state, and provincial child welfare systems persist? Our method is primarily based on the scoping review framework laid out by Arksey and O'Malley, incorporating some recommendations of Levac and colleagues. A scoping study is a type of systematic review and knowledge synthesis that maps key concepts, types of evidence, and gaps in the literature. Scoping studies are particularly useful when considering a broad, complex topic that has not been extensively researched. Scoping studies inform practice and policy and provide direction for research in emerging areas. They are relatively common in medical research, but comparatively rare in social work. The broad aim of the current study is to examine the extent, range, and characteristics of research addressing the involvement of Indigenous families in child welfare, provide a synthesis of research findings, and identify directions for future research. We also characterize our scoping study as a mixed method design. We intentionally integrated qualitative and quantitative methodologies for the primary purpose of breadth and depth. We included empirical studies and peer-reviewed journals directly related to the involvement of Indigenous families in child welfare systems. We included studies of populations from the United States and Canada, including American Indian, Alaska Native, Inuit, Métis, and First Nations. We comprehensively searched 4 online literature databases based on relevance to the topic. We selected keywords under 3 categories: Native population, child welfare, and quantitative, qualitative, or mixed methodology. We then reviewed and sorted the studies. As patterns in the literature emerged, articles were repeatedly sorted until the final pool for scoping was established. Well, let's begin with the first research question. What is the current state of the literature pertaining to child welfare with Indigenous families? As you can see from this table, from the year 2000 through 2017, we located a total of 245 studies relevant to our research questions. Only 37 of those studies involved original empirical data. Throughout the 17 years of this study, 0 to 5 empirical studies were published per year. In addition, 71% of the studies were published in child welfare journals, with 13% in American Indian Studies and 13% in other journals. Approximately half of these studies focused on understanding disparities, primarily in out-of-home placements, but also in kinship adoption, the prescription of psychotropic medication to child welfare-involved children, parents' access to service, outcomes of adult foster alumni, use of differential response, maltreatment substantiations, and investigations. A number of other studies focused on culturally based child protection practices and principles within Indigenous tribes and communities. 3 additional studies provided some evaluation data on practice models with varying levels of cultural foundations. 2 more studies evaluated compliance with ICWA, and 1 study focused specifically on the experiences of Indigenous parents providing foster care and 1 of Indigenous professionals. Only 6 studies focused on specific tribes. 65% of the studies used methods and perspectives from outside of Indigenous cultures. Even if these studies included Indigenous authors, most analyzed data from the administrative records or secondary data sources collected primarily by non-Indigenous professionals, or they used instruments developed within other cultural contexts. In contrast, 27% of the studies prioritized the insider perspectives and experiences of Indigenous professionals, community members, both community members and professionals, and foster parents. With the exception of assessments of 3 evaluation studies that included both insider and outsider perspectives, the experiences of parents involved with child welfare are notably absent. Also notably absent are the perspectives and experiences of children and youth. Only 30% of these studies employed qualitative methods, and 2 studies employed mixed methods, with an emphasis on the quantitative component. Most of the studies used quantitative methods, and most of these studies used large, nationally representative databases, including the National Survey of Child and Adolescent Well-Being, National Child Abuse and Neglect Data System, the Canadian Incidence or First Nation Canadian Incidence Study. Next, I will introduce several key themes that we found in the literature related to why disparities in the involvement of Indigenous families in county, state, and provincial child welfare systems persist. Social challenges experienced by many child welfare-involved families are relatively more intense for Indigenous than non-Indigenous families, and these challenges may contribute to disparities in child welfare involvement. In particular, low income is associated with findings of neglect. In Canada, child welfare-involved Indigenous families tend to be economically disadvantaged than other child welfare-involved families. Indeed, neglect is the largest category of an investigation for Indigenous families. Using the 2008 Canadian Incident Study data, Sinha and colleagues found that neglect only was the largest category of investigations for Indigenous children, and the proportion of Indigenous cases that involved neglect only was significantly higher than for non-Indigenous cases. Using the 2008 First Nations Canadian Incident Study data, They again found that the overrepresentation of Indigenous children relative to non-Indigenous children in investigations was particularly pronounced for neglect. In Canada, other social challenges often associated with poverty, such as housing problems, single parenting, and alcohol or other substance abuse problems, also are more intense for child welfare involved Indigenous families. Sinha and colleagues also found that Canadian workers identified a significantly greater percentage of investigated Indigenous than non-Indigenous households on every caregiver or household risk factor examined except health issues. Caregiver risk factors included substance abuse, history of foster care group home, domestic violence, few social supports, and multiple risk factors. In addition to low income, household risk factors were housing problems, caregiver resource strain, and multiple household risks. These Canadian findings of the relatively intense social challenges experienced by Indigenous families involved in investigations are consistent with those pertaining to families with children in out-of-home care. Based on their analysis of data from the 1998 Canadian Incident Study, Truckmay and colleagues attribute the overrepresentation of Indigenous children both with substantiated cases and those in out-of-home care to disproportionate risk factors experienced by their families. They found extremely high rates of hardships among Indigenous families compared to other families, including unstable housing, alcohol and drug use, and intergenerational maltreatment. They found that proportionately more cases from Indigenous families involved neglect than other families, and family heads were more often single. Canadian findings of the intense level of social challenges experienced by Indigenous families relative to other child welfare involved families are consistent with available U.S. data. Based on case record review of children in out-of-home care in Minnesota County, Donald and colleagues found that Indigenous children were more likely to be exposed to physical neglect than their non-Indigenous counterparts. Their families were mostly single-parent households living in poverty. Although alcohol was a significant problem for both Indigenous and other families, rates were significantly higher among Indigenous families. Another theme that we found was that appropriate services are even less available to child welfare involved Indigenous than other families. Relatively poor availability of services also may contribute to disparities in the involvement of Indigenous families in child welfare. There also is some evidence that services other than child welfare are even less available to child welfare involved Indigenous than other child welfare involved families. Our next theme that we found was that racism presents challenges to available child welfare services. In addition to relatively intense service needs combined with relatively poor access to social services other than child welfare, there is some evidence that state, county, and provincial child welfare services available to many Indigenous families reflects racism at the individual and system levels. First, workers may weigh various risk factors differently for Indigenous and non-Indigenous families in neglect cases. There is also some evidence that Indigenous families and communities' experiences of racism in U.S. state and county child welfare services reinforces their distrust and disengagement from government child welfare services, a legacy from decades of genocide and cultural repression. While this distrust is legitimate and some government services lead to harm, some services are potentially helpful, especially when they prioritize Indigenous culture, partnerships with Indigenous communities, and guidance from Indigenous communities. Red Horse and colleagues surveyed 79 Indigenous people at national conferences and conducted 2 talking circles with Ojibwe elders in Minnesota and Wisconsin. Participants critiqued mainstream child welfare practices as reflecting an ignorance of Indigenous cultural experiences. They observed that mainstream practitioners typically do not have direct experience with healthy Indigenous families and communities. Such inexperience contributes to the development and reinforcement of negative stereotypes about Indigenous people, ignorance of traditional Indigenous support services, and defensiveness among non-Indigenous child welfare workers. They further argued that mainstream child welfare practices that approach Indigenous families from a deficit perspective and emphasize power and control reinforce Indigenous peoples' distrust of white social workers. As we think about our findings, they must be contextualized within our study limitations. First, we note that scoping methodology brings systematicity and transparency to the search process. The actual review of the literature, however, remains an interpretive process. We induced themes from literature that from our standpoints were meaningful. Others may have perceived other themes. Second, we searched literature published in peer-reviewed journals. We did not search the gray literature, such as conference presentations, white papers, agency reports, or dissertations. Clearly, the long emergency of Indigenous child welfare continues, while many Indigenous communities plan for the next 7 generations. In Module 2, we will explore ways forward to strengthen child welfare with Indigenous families.